So here at ASCO 2024, we're presenting a subgroup analysis of the CARTITUDE-4 trial. So that was a trial that enrolled patients with 1 to 3 prior lines of therapy who had received a proteasome inhibitor and lenalidomide and whose disease was resistant to lenalidomide. And those patients were randomized to a standard of care regimen, which was daratumumab, pomalidomide, dexamethasone, or pomalidomide, bortezomib, dexamethasone at the choice of the investigator, or that same regimen used as a bridge leading to cilta-cel, which is an autologous BCMA-directed CAR-T-cell treatment. And that trial was presented last year at ASCO, was published in the New England Journal of Medicine, and was subsequently supported the approval in the United States for cilta-cel for those patients with 1 to 3 prior lines of therapy, which has generated a lot of question and discussion, particularly on the emphasis of the patients who had only 1 line of therapy. So what we did in presenting at ASCO this year is the subgroup with 1 prior line of therapy, with emphasis on the patients that have what we call dynamic high risk or functional high risk, which are patients who had progression within 18 months of the initial therapy or within 18 months of the autologous transplant used as upfront therapy. So throughout the study, there were 68 patients in each arm that had 1 prior line of therapy, and 40 and 39 respectively who had functional high risk. And what we saw, both for the 1 line of therapy population and for the functional high risk population, is that cilta-cel led to more frequent and deeper responses that also translate into much longer progression-free survival. The reduction of risk of progression or death was at the magnitude of 65% on patients with 1 line of therapy, and the magnitude of 73% for those patients with 1 line of therapy and functional high risk. On top of that, we did not see any new safety signal. The high-grade adverse events and severe adverse events were comparable between the 2 arms in both populations. And the same about the CAR-T specific toxicity. CRS was mostly grade 1 and grade 2. There was like a single case of grade 3 CRS. ICANS was in the neighborhood of 5%, all resolved, and we had just very few cases of cranial nerve palsy or delayed movement disorder. So overall, this shows that the safety profile of cilta-cel with this population very compatible. What we have seen throughout the study shows also the benefit, the clinical benefit of this drug, of this cellular drug therapy employed in patients with 1 line of therapy, particularly, but not only if they have functional high risk disease.